The Suppression of Alternative Medicine. This is written by Cindy Perlin, LCSW, and printed in medium.com, February 28, 2024. The suppression of alternative medicine is widespread and dangerous. Mainstream medicine has long colluded with the mainstream media and the government to deprive us of life-saving information and treatments in order to eliminate the competition and increase their profits. This has deprived patients of access to many treatments that are safer and often more effective than the pharmaceuticals and surgical interventions most often offered by mainstream medicine. The earliest efforts to suppress alternative medicine. The war against natural holistic medicine in the U.S. began before the birth of our nation and continues today with the suppression of critical information that would allow us to stay healthy and recover from illness. Started with the Salem witch trials in 1692, and the women who were tried and executed were herbalists who were accused of practicing the devil's magic by men who wanted to control health care. Homeopathy was popular and considered highly effective until, fast forward to the 1800s. Homeopathy was developed in 1827 in Germany and is based on extreme dilutions of natural substances that trigger the body's healing response, like a vaccination. Homeopathic products come from plants such as red onion, arnica, and minerals or animals, and the products often are made as sugar pellets to be placed under the tongue, or may also be in other forms, such as ointments, gels, drops, creams, and tablets. Treatments are individualized or tailored to each person. And homeopathy uses a different diagnostic system for assigning treatments to individuals and recognizes clinical patterns of signs and symptoms that are different from those of conventional medicine. Homeopathy has become wildly popular because it works and was much gentler than the common treatments at the time. These treatments included bloodletting, chloroform, and mercury. It also proved much more effective than mainstream medicine during the cholera epidemics of 1832 and 1849. By the end of the 19th century, there were 44 homeopathic medical schools and more than 100 homeopath-supervised hospitals in the U.S. In the deadly flu epidemic of the 1918, 25 to 50 million people died, while deaths of people treated with homeopathy were rare. Homeopaths created the first medical association in the U.S. in 1844. When the American Medical Association, AMA, was created 3 years later, one of its first actions was to ban homeopaths from becoming members and expelling any members who dared to even consult with a homeopath. In 1910, the Flexner Report, commissioned by the Carnegie Foundation and supported by the Rockefeller family, resulted in standardizing the practice of medicine in a way that virtually eliminated homeopathic medicine. All the homeopathic hospitals and medical schools were forced to close. Perhaps many deaths from the pandemic of 1918 might have been prevented if homeopathy had not already been discredited. Homeopathy has been experiencing a resurgence in the U.S. in recent years as more and more Americans have become disenchanted with pharmaceutical medicine. An estimated 6 million Americans use homeopathy. In 2020, the FDA declared that all homeopathic medicines are to be classified as new drugs, which have not undergone the agency's required pre-market approval process, the new drug application. This effectively has made homeopathy illegal, since this process takes years and the cost is beyond the capacity of any of the homeopathy companies. The FDA has begun to force many homeopathic treatments off the market, despite a lack of evidence that they've done any harm, and our increasing body of research evidence that they're effective. Then they came after the chiropractors. And the AMA and the government regulators had their way. Chiropractic treatment might have met the same fate as homeopathy. The chiropractic profession was founded in the United States in 1895. During the first half of the 20th century, with the active encouragement of the AMA, many chiropractors were prosecuted for practicing medicine without a license, and many went to jail. The AMA founded the Committee on Quackery in 1963. The committee has had the avowed goal of creating a healthcare monopoly that would eliminate the chiropractic profession. Because chiropractic has made little use of technology and no use of drugs, the profession had no strong financial allies. Meanwhile, the AMA has access to the deep pockets of the pharmaceutical industry to further its goals. AMA members face expulsion from the association, not only for referring to chiropractors, but even for belonging to the same country club or church or synagogue. Association was strictly prohibited. In a result, chiropractors face discrimination in not only their professional life, but also in their personal life. In 1976, 5 chiropractors sued the AMA for libel. The suit also included as co-defendants the American Hospital Association, the American College of Surgeons, and the American College of Physicians, and the Joint Commission on Accreditation of Hospitals. 11 years later, a federal appellate court judge ruled that the AMA had engaged in a lengthy, systematic, successful, and unlawful boycott designed to restrict cooperation between MDs and chiropractors to eliminate the chiropractic profession as a competitor in the U.S. healthcare system. In recent years, continued misinformation campaigns and insurance coverage restrictions, including fees that have not increased in 4 decades, visit limitations, and unreasonable paperwork demands continue to undermine the practice of chiropractic. The suppression of alternative cancer treatments. Another area where mainstream medicine has undermined alternative medicine is in cancer treatment. Expenditures on cancer treatment exceed $200 billion annually in the U.S. alone, and suppression of alternative medicine for cancer has been fierce. Despite the claims that we're winning the war on cancer, over 600,000 Americans die of cancer every year in the U.S. Cancer patients are as fearful of the treatments, often referred to as slash, poison, and burn, as they are of the disease itself. A well-known Park Avenue physician, Max Gerson, developed a diet in the 1950s that was curing patients of cancer. He was ostracized, lost his hospital privileges, and felt very ill from being poisoned with arsenic, just as he was completing a manuscript of 50 of his successful cases. He recovered, but his manuscript was stolen during his illness. He was able to rewrite and publish it. The Gerson therapy has continued to be practiced and promoted by the Gerson Institute, a non-profit organization founded by his daughter, Charlotte Gerson. The therapy remains a popular alternative treatment for cancer and other chronic diseases. Also in the 50s, Harry Hoxsey promoted an herbal cure for cancer that was discovered by his grandfather. He was having great success with thousands of patients claiming he cured them. He hired doctors and nurses and opened clinics in 17 states, but was arrested over 100 times for practicing medicine without a license. His treatment was banned in the United States in 1960. One of his nurses fled and opened a Hoxie clinic in Tijuana, Mexico in 1963. The Hoxie Clinic, also known as the Biomedical Center, is still open in Tijuana, Mexico. It continues to offer the Hoxie herbal tonic and other alternative treatments to patients seeking options for cancer treatment outside of conventional medicine. Hoxie himself became an alcoholic and died from the disease as a result of all the stress. In the 1970s, Laetrile, also known as vitamin B17, found in highest amounts in wild apricot seeds, was found to be effective in many studies for cancer treatment. The medical establishment went to great lengths to discredit it, funding studies designed to fail and lying about the results of other studies. Proponents were jailed, and some were shot at and went missing. Books about it were seized, and a law was passed making it a felony to treat cancer with nutrition in California. In 2016, about 60 alternative physicians and naturopaths either died mysteriously or went missing. Many suspected foul play on the part of the pharmaceutical companies. Rumors were that these medical professionals were working on natural cancer cure. Nothing was ever proven, but who could blame those who suspected a conspiracy given the history? The suppression of alternative pain treatments. In the early 1990s, a method of chronic pain care was gaining popularity because of its safety and effectiveness. It was the multidisciplinary pain clinic, where providers from different specialties worked under one roof and provided intensive, coordinated care. The services usually included medication management, physical therapy, exercise programs, psychotherapy, and biofeedback. The number of these clinics had grown to over 1,000 in the United States. Then, Purdue Pharma began aggressively promoting OxyContin, its extended-release opioid, as a safe and highly effective treatment for chronic pain. Purdue Pharma lied about the drug's addictive potential, claiming it was extremely low. Other drug companies began making similar claims about their opioids. Insurance companies stopped covering the multidisciplinary pain clinics because opioids were cheaper, which forced most of the clinics to close. There were soon only about 50 of these clinics left. Today, chronic pain is even more widespread, and over 1 million Americans have died of opioid overdoses since OxyContin was introduced. About 80% of these patients became addicted after receiving an opioid prescription for acute or chronic pain. Despite this, over 131 million opioid prescriptions were written in 2022 in the United States. At the same time, insurance companies continue to deny coverage for other non-pharmaceutical pain treatments, including acupuncture, biofeedback, massage, and nutritional approaches, and to severely limit coverage for chiropractic and physical therapy. Marijuana, which shown to be very effective for pain relief, is still federally illegal. And another herbal product, kratom, which millions use to alleviate pain, is still under attack. The criminalization of health claims for nutrition. In 1994, the Dietary Supplement and Health Education Act, DSHEA, made it a crime for a producer or seller to make health claims for a food or dietary supplement, even if the claims were true, unless the substance has gone through the FDA drug approval process. This process costs at the minimum hundreds of thousands of dollars and is beyond the means of most non-pharmaceutical companies, as their natural products cannot be patented. The FDA has shut down companies, seized products, and pursued criminal charges, even in cases of minor violations of this law. Purveyors of natural products live in terror of the FDA as a result. Yet many of these products have very significant health benefits and can alleviate disease. Suppression of alternative treatments during the coronavirus pandemic. Fast forward to the pandemic, the worst in over 100 years, that has killed millions globally. Though COVID-19 is a new virus, one thing that's obvious from the beginning that people with healthy immune systems do not get sick when exposed to the virus or had very mild illnesses, while those with weaker immune systems got very sick and many died. What had been very striking from an alternative medicine point of view is the complete silence of mainstream medicine and government health agencies, CDC and FDA, about decades of science on ways known to boost the immune system. Well-established ways to boost the immune system include optimizing nutrition, including with diet and supplements, mild to moderate exercise, increasing sleep, reducing stress with meditation and other relaxation techniques, and early herbal treatments. FDA and the Federal Trade Commission, FTC, have been going after any company or practitioner who makes any claims that they can help prevent or cure COVID-19. Social media sites censored similar content, even by established scientific experts, apparently after being pressured by the federal government to do so. One intervention in particular could have reduced deaths by 90%, reducing the carnage from COVID-19 to that of a normal flu season. If that intervention had been widely implemented, we would not have had to shut down the economy and isolate. That intervention would have been vitamin D supplementation, an inexpensive and widely available option. Even before the advent of the pandemic, there's an extensive body of research documenting vitamin D's role in immune system function, and more specifically in preventing acute respiratory infections. In the early days of the pandemic, researchers worldwide started researching the impact of vitamin D levels on COVID-19. A study in Indonesia found that patients with vitamin D deficiency were 19 times as likely to die from the coronavirus as those who had sufficient levels of vitamin D. Even after accounting for other complicating factors such as age, sex, and comorbidities, patients who were deficient in vitamin D were 10 times more likely to die of COVID-19 than those with sufficient levels. Another study out of the Philippines found that those with higher levels of vitamin D had less severe illness when infected with the coronavirus than those who were deficient. Another study looked at the situation from a population level, found that European countries that had the highest prevalence of vitamin D deficiency had the highest levels of infection and death. Another recent study of vitamin D in the coronavirus found that those with sufficient levels of vitamin D were less likely to test positive than those with vitamin D deficiency. Statistics show 42% of American adults are vitamin D deficient. The number is higher for Hispanics, 69%, and African Americans, 82.1%. About 1 billion people worldwide were estimated to be vitamin D deficient. A meta-analysis of available data published in November 2020 found a positive association between vitamin D deficiency and the severity of COVID-19. Low vitamin D levels were also correctable with supplements that are inexpensive and readily available. So why wasn't this common sense treatment that has no side effects being promoted? Because the profits that can be made by mainstream medicine when 7 billion people worldwide are living in terror due to a seemingly out-of-control virus are enormous. And government officials are in on the deal. They got rewarded by the pharmaceutical companies with lucrative jobs, campaign funds, and grants if they play along. Those who don't are ostracized, and their careers and lives are ruined. The mainstream media is heavily dependent on pharmaceutical advertising, so they keep quiet too. The WHO is also heavily funded by the pharmaceutical industry.